Hi, my name is Grace Schultz, and I'm going to be presenting on drug shortages. I chose this topic because working in a hospital setting, I always heard about all these shortages in these drugs, and it just kind of caught my attention as to why this might be happening, and I wanted to know more. So, what is a drug shortage? The Food and Drug Administration defines it as a situation in which the total supply of all clinically interchangeable versions of an FDA regulated drug is inadequate to meet the current or projected demand at the patient level. The American Society of Health System Pharmacists and University of Utah Drug Information Service defines a drug shortage as a supply issue that affects how the pharmacy prepares or dispenses a drug product or influences patient care when prescribers must use an alternative agent. There are three main reasons that drug shortages occur. First is the quality of the manufacturing process, which is due to delays in the manufacturing process or just issues in general causing shutdowns. A big quality manufacturing issue that was delayed in 2017 in Puerto Rico due to the hurricane. Second, there's few manufacturers. We only have 7 manufacturers in the United States right now, and at any given time, a few of them can be having quality issues, which causes a shortage. And lastly is low margin generic products, which doesn't incentivize companies to make the generic products, causing a shortage. And this pie chart shows the reasons for drug shortages in 2013, and you can see that the quality manufacturing issues, along with quality due to delays and capacity, take up 2/3 of the graph. The most common drugs affected by shortages are your sterile injectable products. This includes oncology drugs, which have actually seen a decrease in shortages in the last few years, your anesthesiology drugs, your parenteral nutritional, your electrolyte replacements, and your IV fluids. There are both clinical and economic effects of drug shortages. The clinical effects are medication errors, adverse effects, and delays in care. The medication errors commonly occur because the healthcare provider giving the medication is not used to using the drug and can make an error due to unfamiliarity. Adverse effects can harm the patient due to the drug giving them an adverse reaction that other drugs might not. And delays in care can occur when a drug simply can't be replaced and you have to wait to get that drug in order to care for the patient. Manufacturing issues, the gray market, and increased commodity costs are all economic effects of drug shortages. Manufacturing issues occur due to unexpected delays, usually related to weather, when the sites have to close their facilities. The gray market is when product moves outside normal distribution channels. This occurs by wholesalers stockpiling drugs and driving up the price, creating a price gouging effect. This also decreases the product integrity because we're not 100% sure that the drug we're purchasing is within the standards of practice. It also creates increased commodity costs of up to 11% due to purchasing these drugs off of a contract. The FDA Safety and Innovation Act was put into place to decrease the number of shortages. The premise of this act was that manufacturers had to notify the FDA 6 months in advance of a potential shortage. When unforeseeable circumstances occur, such as a hurricane, they are required to report no later than 5 business days after the interruption occurred. In 2012, it was documented that 195 shortages were prevented due to this act. The problem with this act is it doesn't require reporting of what the problem is or an estimated time for resolving the problem. You only have to report that a problem occurred. If they had to report more specifically, it could help the FDA gather more information and try to target specific problems to produce even more shortages. In November of 2017, the American Society of Health System Pharmacists, along with members from the American Hospital Association, FDA, Department of Health and Human Services, and the Office of the Assistant Secretary for Preparedness and Response, got together and held a meeting on how to decrease drug shortages. These are 11 recommendations that they came up with. The most notable ones are that manufacturers should provide more information to the FDA and try to establish incentives for manufacturers to produce more drugs during a shortage. I think that they should also reconsider purchasing process to make it cheaper for hospitals to buy the drug. Nursing implications can be broken up into policy and patient care. For policy, you can be an advocate and get involved in policy making. Something that could help is to tell policymakers stories of specific patients and how drug shortages impacted them. Second is patient care. Be observant and identify gaps in care related to drug shortages. As a nurse, you can also help implement institutional protocols during drug shortages in your hospital. Here are my references. I hope you enjoyed my presentation and learned a thing or two about drug shortages and how they affect not only the patient, but everyone involved as well.